Hi, this is Dr. Viprajit Das, founder ABXPhysio. We are practicing physiotherapist in Guwahati since the last 10 years. This is the first time we are making a series of videos which we usually recommend to our patients so that they do not forget the type of exercises which you have shown according to their conditions. We are starting with shoulder pain. Now, shoulder pain has so many diagnoses. Frozen shoulder is one of the common conditions which we usually treat. There are three common stages in frozen shoulder. The first stage is the painful stage, which we call as a freezing stage, where the shoulder is not yet freezed, but it is very painful for the patient. Usually they feel pain while they sleep on the affected side. So suppose if this is the affected side, they sleep on this side, they will have the more pain on the night. Now, few exercises to ease that pain. First is a pendulum exercises, where we can just keep your hands relaxed, hanging, and it will rotate in all the directions like a pendulum. It will help to relax the pain. Also, the movements usually are not yet very much restricted. We can use the unaffected arm to help and raise the movement. Raise your arm in few directions. You can do this exercise. If I am showing from the side, you can show this. With this position, you can just reach forward and come back. These are very common exercises to help ease. You can just shrug your shoulders, rotate it forward and backwards. So first stage, the exercises are limited since the pain is more, where we also have other physiotherapy treatments. Now we'll come to the second stage. If the patient comes to us after 2 to 3 months of time, we will see more stiffness, relatively less pain, where apart from the exercises, we have to do a lot of manual therapy as well as other physiotherapy modalities and treatment sessions as well. Now, what are the exercises which usually we recommend in the second stage? Now, let's start with the second phase of exercise. Usually, we take a pipe or a stick like this so that it is easier and it helps. First exercise is, suppose right hand is my affected hand. I will use my left hand and I will push and try to reach as far as possible. First in the front, second on the sides. We have to hold the last movement for a few seconds and then we have to come back. Usual repetition is 10 to 15 times within your pain limitations. Second is, you have to keep your pipe like this. Use your left hand and rotate outside. Remember, right hand is the affected hand, so I'm using my left hand support. Also, you can pull it in. Make sure your elbow is touching your trunk. Third is, if possible, starting position is this. Use both the hands, arms up, pull as far as possible. Usually when it is very tight, patient may not be able to reach a complete range. That's okay. Then if possible, try to take the pipe behind your neck for a few times and maintain the stretch. Then for internal rotation, which you do is, we slide the back. Also, we pull this way. So I'm using my left hand's force to pull the hand that way. Next is, for opening up of this structure, we called as a thoracic extension with the pipe. You keep the pipe here, keep your back straight, push the pipe and bend forward. And slightly, you feel the stretch as far as possible, as long as possible you can feel the stretch. Also in this, you ask the patient to hold it like this and go down. Once they go down, there is automatically a stretch in this area which is usually very tight. So these are the few exercises with a stick or a pipe for the second phase in frozen shoulder. Now remember, in frozen shoulder, it does not happen in a day, so that it will not cure in a day or two. If a patient has reached second stage, it will take 2 to 3 months of time for the recovery. So strength loss of the muscles around the shoulder is also a very big issue. where we highly recommend a strengthening exercise along with the mobility exercise. Previously I showed few mobility exercise with the stick. Now I'm going to show the strength exercises which is recommended for all the frozen shoulder patients. Now in frozen shoulder, lifting a weight is recommended. It will not cause or increase the symptoms, but sudden movement is avoided. So suppose if I have to start, I'll start with 1 kg or 1.5 kg of a dumbbell. Also you can take a water bottle if dumbbell is not available. The basic simple exercises are: pull your hands like this, then you have to lift up, then come down and go down. So it's a sequence of exercise the patient can do for 5 to 10 times. Then you have to rotate arm outside, inside with the weight. So what the weight is doing is, it is adding a distraction force which helps to relax the capsule. If my right hand was affected hand, I can use an inward rotation, outward rotation, keeping my elbows attached along with my trunk. Then I can do both sides, keep my posture erect and relax. Next is reaching forward. If I'll show with the side, from the side, reach forward. You don't have to lift above your shoulder level. Then you can also use a pendulum exercises with the weights in between, just to relax the exercise phase. Then straight arms up with the weights, side raise. All these exercises should be done 5 to 10 times, 2 to 3 sets. But if the patient is unable to do initially, we can reduce the sets or the repetitions. We can also do behind, and we can do this with the weights. Now few strengthening exercise with the support of the wall. First is scapular push-ups, where we activate the muscles which stabilizes the scapula. Is doing this. You can do it initially, we can do it in between, you can do it at last. Second is wall push-ups. Remember, you have to hold the position here, keep your spine straight and push with your hands. Next, you can take a ball or a towel which slides on the surface. We have to start at the end range because we have to focus on mobility. Press the ball and raise up. Maintain the pressure on the ball throughout, range up and push upwards. Then with your dumbbells, to correct the posture and movement quality, is keeping both the hands like this, rotate outside and touch the wall. Make sure you are touching the wall when you are standing. If you find it a little difficult, you can come a little forward and lean on the wall. From this position, maintain this posture and raise your arms up. Now, since we are done with the wall support, these were the exercises for stage 2. Next, we will start with stage 3. Now coming to stage 3, where the range is gradually improving, but we need to focus on the end ranges as well as a strength which has to be progressive in nature. We will increase the weight according to their capacity. So suppose I am using a 5 kg weight dumbbell. So I'm using left hand for the reference. So you can use a bed or any surface. We have to, it's called as a single arm row, which is very important to stabilize and strengthen the shoulder muscles. Then if possible, it's usually a little difficult, patient have to do a side raise and backward raise. Second, with sitting, patient have to do a single arm shoulder press. Now we will start some exercises of shoulder on a bed, or you can also do it on a floor. First exercise is same scapular push-ups on the bed. Second is child pose. You have to keep your arms here so that it stretches your inner side of the shoulder. These exercises can be done in the first and the second phase as well. Third is patient will lie on their stomach, keeps your hand beside your shoulder, press with your arms and lift up. The progression of this is knee push-up, and then progression is normal push-ups. Next set of exercises we called as IYT. It is very important to stabilize and improve the mobility of the shoulder. Let me show you. We have to use a high couch. This couch is little low. You can use a higher couch. You have to lie so that your head and your shoulder is outside the couch. Your head will remain straight. You will look down. So keep your both arms straight, thumbs direction up. Relax your body. Raise your arms up and stay. And now. Same way you have to raise your arms in 45 degrees and 90 degrees. So name of the exercise is, you are making an I, you're making a Y, you're making a T. Progression is, you have to use a weight. Same way, I, Y and T. Next set of exercises are the combined exercises, where your head will be supported with a pillow or a towel. Then in this position, these are some combined exercises. Lift your arms up. You can keep your fist up, down, rotate, next is up, up, next is this way, next is this, this. Now few exercises in lying down on your back. First is single arm chest press. You have to maintain and stabilize so that it does not shake. Then for rotation, gentle, for internal rotation with weights. These are all for the third stages where we need the range. This rotation is the last rotation that you will achieve. Fourth is overhead extension with weights, which is pulling your hands behind. Then scaption or scapular push-ups with weight. Also a little bit of crunch you can add in this. Now we have compiled all the exercises which we usually recommend to our cases in the case of frozen shoulder. There are so many other exercises, but most important exercises we have tried to cover. Hope this video and the set of exercises help you guys. Thank you, and signing off, Dr. Viprajit Das, ABXPhysio. Thank you, and signing off, Dr. Viprajit.